Priscilla is disfigured for life.
I think it's super insidious for doctors to point out more features that can be improved to people who have already low self-image.
Cosmetic surgeons are partnering with marketing agencies to get their services in front of people as young as 14. People with confidence have better relationships, better careers and better lives. And from landing you the leading role in a Hollywood blockbuster or a multi-million-dollar advertising deal with Fendi or Michael Kors, to getting you a lighter sentence if you're convicted of a crime, pretty privilege is here to stay. Rightly or wrongly then, we get our nose job, our breast augmentation and our lip plumping injections, as you know, precisely because we want confidence in our appearance, along with the quality of life that often goes with that. And there's every chance, in my opinion, that the various cosmetic surgery procedures undergone by Ariana Grande, Kendall Jenner and Selena Gomez, for instance, have given their respective confidence levels a massive boost. And the same goes for numerous social media influencers, particularly those on TikTok and Instagram, who have transformed their appearance with cosmetic surgery. So how can anyone claim that there is any sort of problem connected to cosmetic surgery or plastic surgery? Where extreme cosmetic surgery is concerned, there are lighter examples.
My name is Paulina and I spent over £200,000 for my plastic surgeries.
Medium examples.
This is extraordinary, yes?
At the moment, your bottom is 80 inches?
83, 84.
83,
yeah.
84.
And stronger examples.
Enter Jocelyn Wildenstein. Jocelyn Wildenstein almost always ranks number one on the reason why not to get plastic surgery, and it's not difficult to see why.
And where medium and stronger cases at least are concerned, one can certainly argue the point regarding the misuse, if you will, of cosmetic surgery. Cosmetic surgery is meant to beautify people, not lionessify them. We'll save our conversation on what is considered beauty for later. But to head off any notion that extreme cosmetic surgery is truly a problem, if adult individuals haven't got autonomy over their own bodies, then who exactly do we owe our bodies to?
It's normal and it's good for me. I'm happy with this look.
I have a goal to have a world's biggest bum.
After undergoing a series of cool sculpting sessions where fat is frozen, top 5 90s supermodel Linda Evangelista, who began the treatment when she was about 50, found her fat expanding, meaning that instead of looking slim and attractive, her neck and jawline fattened. Linda made no secret about the damage that this did to her confidence. The doctor who injected industrial-grade silicone into Priscilla Presley's face was sent to prison and subsequently deported back to Argentina from the US. That type of silicone generally can't be removed from the face. Priscilla is disfigured for life. I doubt Priscilla was warned about the dangers of her silicone shots, but firstly, we can't necessarily trust the thousands of beauty influencers on TikTok and Instagram to share the risks of the cosmetic surgery and the other cosmetic treatments that they have undergone.
And many influencers are often getting procedures for free in exchange for posting and raving about the results without explaining things like the risk or cost associated.
And secondly, where non-surgical treatments like filler are concerned, people are increasingly dismissing the risks anyway.
I think social media glosses over the risks of injectables. Injectables have become so common and people see it everywhere, and I think they're kind of comparing it to, say, a hair salon appointment or getting a facial, and it's really not the same thing. It's a medical procedure and it needs to be treated that way.
The risks, however, are real.
But even in the best of circumstances, the most trained person, a complication is still always possible. There can be things like blindness, loss of skin.
Many attribute TikTok in particular with the normalising of plastic surgery, while no less recognising the potential benefit in what is effectively the end of any stigma attached to the undergoing of cosmetic surgery. But cosmetic surgeons are, people have shown, flaunting TikTok's highly strict advertising rules and partnering with marketing agencies to get their services in front of people as young as 14. Possibly in combination with indirect advertising from influencers on whom they've performed cosmetic procedures.
In a lot of cases, a provider may expect that the influencer is going to post about the procedure on their story and tag them, which can then direct a lot of attention their way.
Yes, many agree that it's good for young people in particular to see that attractive people weren't necessarily born with their looks, and that, with adequate financial resources, not just celebrities, but regular people like them can basically buy beauty. But there is serious concern that by seeing so many other young people getting the nose, the lips or the chest of their dreams, young people with severe confidence issues regarding their looks and lacking either the money or the age required for cosmetic surgery will just feel more and more left out. The Kardashians, many agree, have played a major part in the deriving of the so-called Instagram face.
Gia describes the Instagram face as a young face, of course, with poreless skin and plump, high cheekbones. It has cat-like eyes and long, cartoonish lashes. It has a small, neat nose and full, lush lips. The face is distinctly white, but ambiguously ethnic.
Numerous cosmetic surgeons have reported how great Kim Kardashian has been for business. We'll save the discussion on the rights and wrongs of Kim Kardashian's transition from a slim, thick figure, which included the very large bottom that sparked the BBL trend that thousands of women all around the world latched onto, to a massively skinnier figure bordering on the heroin chic, for another time. So, black ladies are now being admired for their big lips and their big bottoms, a look that's been mimicked by numerous non-black ladies, rather than being bullied for those features, right? Asian ladies are now being desired, all thanks to the upward slant to the outer corners of their eyes, a look that a large number of non-Asian ladies have achieved with fox eye surgery, yes? As if.
And of course, really luscious lips.
Like, we always had that naturally, but it was never, oh my god, your slanted upwards eyes are so sexy. No.
People basically like seeing those features in any woman except those from the ethnic groups where those features actually originate. A person with a hollow mid-face requesting to have volume and definition added to their cheekbones by means of filler is clearly manifesting a significant insecurity relating to their appearance. So for a surgeon to try to upsell that same person filler treatments to their chin, lips and jawline too is obviously for a surgeon to compound that person's insecurity. And I hear tell that, where some surgeons are concerned, this very much goes on.
A lot of doctors have a tendency of offering multiple procedures, even though you had only come in for, let's say, a lip filler. I think it's super insidious for doctors to point out more features that can be improved to people who have already low self-image.
More and more men, especially young men, are coming forward for cosmetic enhancements. But compared to the number of women getting cosmetic surgery, their numbers are, I believe, still negligible. And in keeping with that, unlike in the case of women, for a man to age is not for a man to lose his attractiveness, if any, or his value.
Well, but remember, it's okay for a man to age. There's that commercial with some hair tonic thing that says, you know, just a touch of gray, and that's okay. You know, if you look too gray, it's not good, but some gray, try that on a woman. There's not one thing that would say a touch of gray is going to make you look experienced and actually keep the job. It's a different standard, as we know. It's a very different world for women.
And aren't men, especially those from the Western world, precisely who we ladies are all trying to impress with our lip plumping treatments and our breast augmentations? Chiefly because, in any given society, men still tend to have the power. The risks, the potentially destructive influence on the young, the practice of making trends with our bodies, which can include borrowing from particular ethnic groups, but no less leaving them out of beauty. People with insecurities about their appearance, having those insecurities reinforced and added to by unscrupulous, money-loving cosmetic surgeons. The value attributed to a given woman often being determined to a significant degree by her looks, unlike in the case of men, the ones who tend to do the valuing of women in the first place. These are, many feel, the problems associated with plastic surgery. If you've enjoyed this video, then I recommend you to watch this one next. I'll meet you there.